to a certain limit. You want to, in the emergency room, when the blood pressures are dropping, we'd like to at least have it above 90, the top one above 90. Now you can have isolated systolic hypertension, which actually the top number is systolic, the bottom number is diastolic. So the top number is the force of the heart, the cardiac output, putting that force out there. Cardiac output is, well, that's physiology. You probably don't want to hear it, but I'll finish it. It's defined by contractility of the heart, which is the force of the heart beating, and the heart rate. Force of the heart beating and the heart rate. So if your adrenaline goes up, for instance, it may make your pressure go up a bit. That's why it's not good to argue with people. Besides, you know, if you argue with a fool, they won't be able to tell who's the fool, right? So what happens, the adrenaline stimulates neuroreceptors in the heart, which increases the strength of the heart beating and the rate. Okay, that's what happens when you're lying down, and you know how you're lying down and you're in a fuzzy world and you're just so relaxed, because that's your parasympathetic fuzziness, your relaxation. Neurotransmitters are just busting all through the body, making you feel good, and that's why you don't want to get up. And then if somebody gets you up, you know, get up, husband, go do something, or get the child, then you're up. Okay, you can go back to bed, and what do you say? I'm up now. That's because hormones come up when we get up, because they come up because blood has to go to the head, right? When you're lying down, it's easy for the heart to push it to the head. When you get up, the cardiac output force drops the pressure going to the brain, and you have receptors that tell that the pressure drops going to the brain. And if you get up too quick, you'll feel dizzy because there's not enough blood going to the brain. So what happens when you get up, these receptors say, hey, the pressure's changing, the sky's getting up, and then it sends a signal to the adrenal gland and other glands that produce hormones that are not so pleasant, because they make your heart rate go up, you know, the contractility and other various unpleasantries. And then once you're up, those hormones, just because you lie back down, are not going to go away. I'm up now, I'm, you know. So I think, you know, I just wanted to get you in the mood of talking about physiology. Now, physiology is the study of normal function. Okay? Now, so the systolic top blood pressure is the heart beating and the force of the heart. So what's the bottom pressure? Well, the heart beats, and then there's resistance in the tissues. There's not a zero resistance, because well, the aorta would just have an open system. It would shoot out to the atmosphere, to a vacuum, so that would have zero resistance. But there is resistance because you have tissues and blood vessels. Now, what if you're tense? Well, there are actually muscles within the arteries. Now, the arteries have muscles. That's why they're thicker than the veins. The arteries run deeper in the body. That's, you feel the pulse. It's a force, right? And the arteries are thicker because there's smooth muscle cells around there that are also activated by mind neurotransmitters, mind-induced neurotransmitters, that if you're anxious or something, it can go and causes a squeezing of the blood vessels, and that increases the blood pressure. So your mind can do it. Also, you can have hardening of the arteries, atherosclerosis. Athero means artery, sclero means hard, and osis means too much. That's hardening of the arteries. And then that forms, that can set up tightening of the vessel. It's not as pliant. It's not as resilient. It becomes hard and crystallized as it goes on. Now, can you guess what percent of the population has hardening of the arteries in, let's say, 50 or above in the United States and Western lands? It's 85%. 85% of people in their 50s or over have hardening of the arteries. In the 40s, it's 71%. In the 30s, it's 60%. In the 20s, it's 37%, and under 20, it's 17% of all Americans have hardening of the arteries. Typically, if you eat the typical American food and live that lifestyle. So, that hardening of the arteries then increases what we call the total peripheral resistance. Periphery is outside, the central areas where the heart is. So the heart's pumping, and then that resistance goes up. And that's another factor in high blood pressure. Okay? Now, are there symptoms always in high blood pressure? Oh, my mic fell. Are there symptoms in high blood pressure always? No. And that's why they call it the silent killer. You could be walking around. I've seen people walk around with blood pressures 220 over 112 and don't even know it. Yeah? So, but what are the symptoms of high blood pressure? Dizziness, headache. If you're having a heart attack, chest pain. If you have clogged up arteries in the heart, and the heart has to beat harder to push through the plaque and that total peripheral resistance, then you're increasing the oxygen demand of the heart. And how's oxygen carried to the heart? By the coronary arteries. And if they're clogged up and you're increasing the demand, you're going to get a Charlie horse in the heart, and that's angina pectoris. Pectoris means chest, angina pain. Okay? And that's why we give nitroglycerin under the tongue. It can lower the blood pressure, but basically nitroglycerin relaxes all the smooth muscle cells in the body, so then the heart has to work less hard to push. And that's how it decreases chest pain from heart disease. You can get emotional problems, restlessness. It can cause cloudiness, headache. It can cause a stroke because the blood pressure, first of all, every time the pressure's up, it's like a vicious cycle. Hardening of the arteries causes high blood pressure. High blood pressure, wearing out the arteries, damages the arteries and causes high blood pressure. Or high blood pressure causes hardening of the arteries. Anyway, they each cause each other. So in the brain, then you could have hardening of the arteries generated by high blood pressure, and if the blood pressure pushes through there, it could burst and get a aneurysm. So anybody who has aneurysm wants to keep their pressure mellow. Another way of stroke is a clogged up artery. Yeah, that's a thrombotic stroke. All right, so, and also it can cause kidney disease. It can cause kidney disease, and hardening of the artery, literally, and high blood pressure generating it, and diabetes as well, are the #1 and 2 causes of chronic renal disease, needing dialysis. Those dialysis units are popping up lickety-split. It's ridiculous. And, who wants to be stuck on a dialysis unit, really? So what causes high blood pressure? Well, poor diet, obesity in some, high salt, high fat. Now, does everybody know the story about why African Americans in particular, some of them are statistically have higher rates of being sensitive to salt? Because in the Middle Passage, you could survive better if you could hold on to salt. So there was a selection, a natural selection. People might die if they can't hold on to salt and water. But if you can hold on to salt and water, then you're more likely to survive the Middle Passage. So therefore, African Americans have a higher rate of being sensitive to salt than say the population in Africa or Europe. What about low potassium and magnesium intake? Low potassium and magnesium intake, which are mostly in fresh fruits and vegetables. Okay? Certain nutrient deficiencies, calcium deficiency. Oh, and then all the minerals, potassium and calcium, B vitamins, folate. Hardening of the arteries can cause high blood pressure. Anemia can cause high blood pressure because you need more pressure and more contractility to pump the fewer cells around the body. So you have to squeeze the blood vessels so you can decrease the volume and get more movement more quickly. Therefore, the oxygen can be exchanged more quickly. Lead and cadmium, 2 heavy metals that we get rid of with chelation therapy, can literally make your blood pressure go up. Lead and cadmium. In fact, as women reach middle age, lead is stored in the bones as well as cadmium, but lead especially in the bones. Modern people have 10,000 times more lead than pristine, quote, pristine ancient people. And the lead deteriorates as the bone breaks down from osteoporosis. And in peri and postmenopausal females, lead is released in the blood and causes high blood pressure. How do you get rid of it? With chelation therapy. And you can decrease the bone deterioration by a more vegan-orientated diet. Does everybody know what that means? Yeah, the prime vegetarian diet. Because the flesh foods cause sulfuric acid in the blood, and that is causes the kidneys to neutralize it by pulling calcium from the bones. And then you get more kidney stones because the calcium is discharged to the kidneys. So that type of diet is also associated with kidney stones for the same reason. Deep, huh? You didn't know you'd be so understanding of physiology. I should be a teacher in a medical school, shouldn't I? Okay. Alcohol alone can cause high blood pressure. Alcohol. And 1 drink a week of alcohol can increase the chances of breast cancer in females. That's pretty deep, isn't it? Caffeine and cigarettes can cause high blood pressure. And of course, illicit drugs like cocaine can. Many people have gotten strokes with cocaine and things such as that. Okay, so the mortality risk, high blood pressure kills probably 75 to 100,000 people per year in the United States. It's a major factor in at least 250,000 to 500,000 other deaths. We talked about totally in America, about 1 out of 4 Americans have high blood pressure. It's a major cause of heart attack, stroke, congestive heart failure, because what happens with congestive heart failure, if the blood pressure is elevated and you don't feel it, you're fine. But the heart feels it because it's got to push against that higher blood pressure. And it gets abnormally enlarged until it reaches a negative point and it becomes less efficient in pumping blood. And the percent blood coming out per pump decreases. And therefore, you get fluid accumulation in the lungs. And you get congestive heart failure from untreated hypertension. So normal is normal is normal. Just because you feel good doesn't mean anything. Most of the people walking around who are HIV positive feel and look great. So the problem with drugs, now note, the highest blood pressure I've ever seen in my life so far was about 280 over 180. And that person was in an emergency room bed grabbing their chest and grabbing for me, "Doc, help me. My chest is hurting. I can't breathe. Help me." Man, I gave that guy nitroglycerin. I gave him Lasix IV. I gave him morphine. I did so much stuff to him. Give him this, give him that, give him that, give him this, and give him some more of that, and keep that guy alive. And then we put him in the intensive care unit. And then the last time I saw him, he was just standing around. Say, "Doc, come here. How you doing, man?" I said, "Do I know you?" He said, "Yeah, I was down there that day." I said, "Okay, well, I'm glad to see you survive." So, you know, certainly when you have that type of level of high blood pressure, it's really good to treat it with drugs. That's what they're for. And they worked on that guy. And then we can get his diet together and everything. And it's now borderline blood pressure coming in my office, I don't necessarily treat with drugs. Some doctors will, because I expect people to change their lives and get it together, you know. And in my office, you know, one of the main things we have, people always are getting dizzy in my office, at least earlier, because when they do the chelation, when they do the dietary changes and they get themselves together, their blood pressure's dropping. They don't need the drugs anymore. I remember the first time that happened, this elder, he was on 7 drugs for his heart and blood pressure. Said, "Dr. Richards, I don't feel good. I feel kind of dizzy." I'm like, my goodness, what have I done? You know, like, do no evil, right? Do no harm. That's a Hippocratic oath. I said, what have I done? I went all those years of school and here this guy's not feeling great. And I measured his pressure and it was like 90 something over. I said, okay, I think we need to decrease these drugs. And then 2 weeks later, doc, not feeling good again, lower the drugs. So now I try to get the people more involved as soon as you feel something and start cutting back. You know, it's really a pleasure. I've gotten so many people off of drugs, it's not funny. I don't think the drug companies would like me too much. Yeah, but it's really true. It can be reversible. Now, there are a few cases of people who have secondary high blood pressure. Most high blood pressure is primary, and we call it essential, and that's generated by the industrial big city complex. And it's not just in America. You go to Nigeria, Lagos, nothing but Africans in that city, and in the cities they have high blood pressure. You go to the country in Lagos, low blood pressure. It's the same theme, same type of theme. The problem with high blood pressure meds, they can have side effects. They don't always work. They can cause disease. One popular drug, hydrochlorothiazide, which is a thiazide diuretic. Okay, blah, 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 blah. It can cause kidney cancer in some people. You've heard that? Yeah, and you're the only person who just about knows that besides me almost. I mean, Dr. Douglas Collins, who's a noted hematologist, oncologist, lectured to us and told us that. Brilliant man he is. It can cause hip fractures because diuretics can cause osteoporosis. It can cause worsening of gout. It can cause mineral deficiencies and whatnot. It can cause diabetes even because it can make the sugar up. Some blood pressure pills make the sugar up, the cholesterol go up as well. And some high blood pressure pills can lower coenzyme Q10. So coenzyme Q10 we usually do recommend. And then cholesterol lowering drugs cause cancer in mice and rats, and it can drop the coenzyme Q10 deadly low, give you muscle aches and everything. And you know, we can, in our clinic, we have cholesterols drop from 296 down to 146, 136 by dietary manipulation. And we have cholesterol pooling agents that are of herbal nature. And they're not even to be used totally. But the few cases of high blood pressure can be caused by tumors, pheochromocytoma, you know, different things, setting out certain bad hormones. But that's very rare, really. Most high blood pressure is essential. Okay, and then in particular, you know, you notice African Americans, I just want to say this, between the ages of 24 and 44 are 18 times more likely than European Americans to develop kidney failure due to hypertension. 18 times. And part of it may be that salt retention, it may be poor diet, less fresh fruits and vegetables. A study was done in the 60s, which I think is interesting. They compared in Mississippi young Caucasian females and black females, pre-teens to teenage years, and they measured their dietary intake, and they were equal about in the salt, but the Afro-Americans had a lower potassium intake because they ate less fruits and vegetables. They were eating more of the meat and all that sort of stuff. Okay, so we went over why it can be a silent killer because you don't feel it. And the first sign of a high blood pressure in some people, if you don't have it measured, which you should be on top of your high blood pressure. It's funny, about 3/4 of a year into me being a hypertension fellow, it just occurred to me I hadn't measured my blood pressure in years. I said, boy, wouldn't it be ironic? So I sat there and measured it and meditated because I didn't want to, you know, and it was fine. But you should keep up with it, you know, even if you're a professor. You can be susceptible too. So the first sign of high blood pressure, if you don't know what it is, can be a stroke. It can be loss of vision, heart attack. First sign of some heart attacks is instant death. So it behooves us to know our blood pressures, doesn't it? Now I want to talk about some solutions here. Now that I presented the problem. All right. Okay. Solutions. Okay. Well, first of all, you know, sound medical management is important. You know, it's a judgment call. If your blood pressure, you know, I will definitely treat if your blood pressure is like getting over 160, over 90 or 100 or something like that, you really need to do something. Now there are some herbs that I have from China that seem to be quite strong. For many people it works. It's called BP Balance. And but you know, and then what I'll do sometime is use a smaller amount of drug and add other things, especially our disease reversal program. And the big thing is chelation, which we'll talk about later. So sound medical management as necessary. They got blood pressure cuffs all over the place in the drugstores. Go in there. It's up to you to know your blood pressure. And then quit eating fast food, junk food, dairy, tobacco, meat, alcohol, all those types of things.
Hey, Doc.
Yes.
In sound medical management, also weaning off of the drugs and being careful how one goes about, you know, the sound medical management.
Right. We had discussed that earlier about getting dizzy from too much high blood pressure drugs. Then there's a way to wean it. We wean it very carefully in my clinic now that we've learned our lessons, and we stay in deep communication with the patient, and I help them, aid them in giving them schemes to get out of the blood pressure medications when they earn it, when it's appropriate. So that does take responsibility. Stop being hypnotized and manipulated by the advertisements. That's one reason I don't have cable in my house, because I have 6 children, and I just frankly don't want them to be affected by this culture's, by the negative side of this culture. There's of course a positive side as well, but they put too much negativity on TV, you know. Diet is very, very important. All you need, diet can even reverse hardening of the arteries, and when you do that, you can get a decrease in blood pressure. A low-fat, high-fiber diet, and cut out all the cholesterol. That means more vegan diet. Cholesterol. Now, cholesterol is a double-edged sword. Of course, it's good because it's a precursor to sex hormones, and none of us would therefore be here without cholesterol. Number one. Number two, it smooths out the blood vessels. And it's better to have a cholesterol of 140, you get a little smoothing, but if you have a cholesterol of 280, it's going to lump it. So that's really how that goes. Stress reduction management, meditation alone can lower blood pressure. 20 minutes twice a day. Transcendental Meditation has done studies with that. That organization has. And regular meditation as well. Exercise is also something that can work. But I think people should meditate, especially at night, and if your blood pressure's still up or you don't feel like you can handle it yet, meditate in the morning and do the stretching and meditation in the morning. Exercising is very important. I always say I recommend exercising 3 times a day. When you first get up, and you can start with 5 minutes or 10 minutes or 15 minutes. Do some stretching, a few jumping jacks. You can put some music on. You can put James Brown on, Led Zeppelin, The Temptations, whatever pulls your cord, or all the above is best. And then take a walk in the middle of the day, and then at night do relaxation meditation. That's exercising 3 times a day. It increases oxygenation to the cells. It just burns body fat. Obesity is independently associated with hypertension. Stop smoking alcohol and caffeine, and we discussed that. If you know anybody who smokes, tell them to stop smoking the house car first thing in the morning. That's a good way to start. And then herbs and nutritional supplements. Calcium, L-carnitine, selenium, essential fatty acids, vitamin C, B vitamins, lecithin, vitamin E, coenzyme Q10, garlic, hawthorn berry, parsley, black cohosh, valerian root if you're nervous, to relax. Cayenne pepper. You know, when I went to Nigeria, they use cayenne pepper like we use salt and black pepper. I mean, they just put it on there. And it really clears out the blood vessels. It's really good for you. Google. It pulls out cholesterol out the body. Passion flower is hypnotic, helps you rest and sleep. Okay? Now, a big thing that we do is EDTA chelation therapy. It's an IV treatment that pulls the heavy metals like lead, cadmium, arsenic out of the body. And that lowers the blood pressure as well as reverse hardening of the arteries. It's a big thing. It's our biggest treatment that we do. It takes 3 hours to give. It also decreases cancer rates because it pulls heavy metals from the body. It's remarkable, absolutely remarkable. And we've seen many folks' blood pressures go down. And the more resistant, we have to add, of course, the meditation and the exercise. I have one gentleman in the clinic. He's lost about 150 pounds, changed his diet completely, cholesterol's great. He's exercising now, and he's on a mission. He's taken a little bit of pill, but definitely on a different direction than he would have been. So I'm real proud of him. There's lots of herbs that you can use to flavor food besides salt too. And you have to get used to a lower salt diet. In America, we use about 20 grams of salt, and you only need 250 milligrams.
Per what?
Per day. And that's 20 grams per day. That's what the average American uses. We only need 250 milligrams. I mean, so 20 grams is like a 20000, and you only need 250. I mean, that's a lot.
So we use 100 times what we should be using.
Yeah, and in ancient times, the salt was so unavailable that they used to pay people in salt. So that's where the word salary came from. And some animals, they need a little salt. Sometimes if my throat is tickled in the past or something, you need a little salt to give it a nice fluffiness. And that's why you gargle with salt, but you spit it out. You know, if your blood pressure is low, sometimes we will actually give people elixirs with a little salt. And of course, when we give the IV, we give what? Salt and water. Literally, if you need it. You know, somebody who's been vomiting 12 times, blood pressure is low, their tongue is dry, it's like, get a bag. Yeah. So that's high blood pressure. And what I want to mention is we have available certain products to help with high blood pressure. Basic herbs, Dowie cleanse, because you want to do a general cleansing first to clean yourself out. Then there's specific herbs for high blood pressure, HS2, hawthornberry, parsley, garlic. Those are something you can stay on. High potency garlic, coenzyme Q10, blood pressure X. Those are herbs we all have available, and we can make deals tonight. We have information available, weight loss information, high blood pressure tapes, weight loss tapes. We have the high blood pressure manual that we can get you. And we have this other elixir called Cardio Cocktail with L-arginine, which has a vasodilating effect on the body because of the arginine, which is an amino acid. It's very safe. And what it does, it expands the blood vessels. And you do it twice a day, and it has a lowering effect on the blood pressure, and it has a reversal effect on hardening of the arteries. Any combination of these things. Now that's where the art of medicine comes up. You know, the art of medicine. Which do you use? That's why you need practitioners sometimes. You know, and of course you can use your own intuition and your own logic as well. That's all we all have. And actually, Dr. Carter is here. Dr. Carter's another colleague of mine, and he turned me on to Cardiac Cocktail. And do you have that machine with you?
Yeah, if you want me to set it up.
Yeah, he has a way to measure how resilient your arteries are, and that's really a good thing.
It will actually give you a biological age of your arteries.
Yeah.
So even though you might be 20 or 30, your arteries might be 50 or 60.
Yeah.
And I found out mine were a lot older than I am.
Yeah, he looks
Primarily
good.
because I'm not a vegetarian.
See, he admits it.
Yeah. Right.
Very honest, very honest. But he's changing.
Yeah.
We're working on him.
Yes, yes.
Yes, sir. We're going to open up to questions now. Go right ahead.
Well, since cholesterol, your body produces a certain amount of cholesterol.
Absolutely.
And the rest of the stuff, the only way you're going to get cholesterol is if you eat animal, you know, whether it's milk or fish or anything like that.
That's right.
So if you have a diet of a vegetarian diet where you don't take this at all into your system, then what level of cholesterol can you expect to be measured?
About 125 to 170. Now remember, the lab used to say less than 300 was normal. Remember that? My friend Ken Johnson is a lab expert. And then they decreased it to 250, and now it's less than 200. But they're still wrong. It's 125 to about 170. And even 170 is a little high maybe. But then the LDL cholesterol, they say, should be less than 130. That's not true. And then they say for people with risk factors for heart disease, it should be less than 100. Everybody should be less than 100. Yes. That's the bad cholesterol, yeah.
Is there a difference for the cholesterol for females versus males? That's one. Two, for African American females, males than European. And what are the charts that they give us are based on what statistics?
The charts are based on first of all, they were based on what they see in the general population, all collected. And then they started putting in what they think is normal, which is what I do. Okay, to find out what normal is, you'd have to go to some some remote African tribe or something where they still are naked, and therefore they're not westernized. The answer to the question about the race, I have not seen a difference with that per se. No, male and female, yes. The females generally seem to have higher rates of good cholesterol, which is one reason why they live longer to a certain extent. That protection seems to go away post-menopause somewhat as you get older, and that's why actually females have higher rates over 70 of heart attacks than males.
What
Yes.
we also want to notice on that is the more information you have about this, the better. We're talking about cholesterol and we're talking about a vegan diet. That's nice, that's good, that's to be had, but what about trans fatty acids? What about hydrogenated oils? What about cooked oils? We really shouldn't eat cooked oils. We should eat cold pressed oils in the original state. So actually, like flaxseed oil, olive oil, that goes in our body and synthesizes well unless we cook it, heat it, those kind of things, transform it into something else, and that kind of thing. So the more information that we have, that's why we have a lot of tapes and DVDs and CDs and manuals and recipes and all that, because people get bits and pieces of the information and have bits and pieces of the program as opposed to, in case you don't know, I'm John Richardson, his brother.
That's right.
Yeah, we've been working together for 20-some years. So, people, all of us, we get kind of, because of the way society's set up, we get a little sketch of something and we're satisfied with it and we think we have it all, not even close. So that's why I tell people, when you're fully educated on any illness, not only high blood pressure, but anything, then you can go to war against it. Because if we just have a little, because we tend to take sound bites in this society and the superficial analysis of it, then I think we should become an expert. I do. Our patients, when they leave, we want them to go out and lecture and talk to their churches and do whatever, this kind of thing. And in order to do that, you have to study. You can't just, is it cholesterol? It's more to it than cholesterol pieces,
That's a good. She had a question next. Yes.
Does apple cider vinegar have blood pressure or diabetes?
I've heard that.
I've heard it. I haven't satisfied myself to be able to tell you, yes, it certainly does. I have no reason to say it doesn't. I use apple cider vinegar in my own food preparation, and I think it's beneficial. I believe it is, but I can't say I know it is yet. And I hope to see some proof or prove it to myself one day.
You do see that in the literature a lot.
Yeah, there's some literature. I haven't seen it in medical literature yet. Yes?
Well, I was just going to make a comment on what you said before. There was a doctor that wrote a book on the very fact that he stresses that almost all diseases that you get are due from processed oils. And he went and studied indigenous people all over the world and found out that he said this is the only thing that was the difference than the other people outside of that and stress. But he said
rave diet.
Yeah, the rave diet addresses that. And then some people have also studied that. I mean, the indigenous people all around the world had it going on, to tell you the truth. In ancient Europe, it was the rich aristocrats who could afford to get the refined pastries who got sick, not the general population. In Zaire, Congo, it was Mobutu Sese Seko. He lived high on the hog. He was a greedy ruler, and he died at 66 from prostate cancer when his countrymen never got that. Many examples, yes.
have like high cholesterol that not to eat too many greens. Have you heard that?
I have not.
The opposite.
Absolutely
Yeah,
not.
I'm just wondering
The
where that
opposite.
comes from. Oh, you can't eat too many the greens and things.
Well, what they may be eating, what they may have is, they may be taking Coumadin.
Okay.
Rat
Coumadin
poison.
thinner.
Yeah, it's a blood thinner, and
blood thinner. That's
right,
what
it's
it
the
is, yeah.
Coumadin, and
Yeah.
and the greens have vitamin K, which is an antidote to the Coumadin. So you're trying to thin the blood, and here you're taking greens with the vitamin K. And then what you have to do, if you want to eat greens, you just got to take more rat poison. See, all drugs are, well, I'm sorry. I tell, if you had a blood clot, a pulmonary embolism, and you had a deep venous thrombosis, I will write you a prescription for rat poison because it will save your life. But you just have to get it regulated, and I've done that, Mr. Frank. I mean, it saved his life. But all drugs are poisons with desirable side effects.
But also, let's understand, greens, especially raw greens, is a way to deal with the whole thing.
Yeah, it is.
Raw greens. Raw greens, what?
I hate to
That's
see
what the
people.
cows eat, the gorillas
I hate to
eat.
see people come to my office on Coumadin. It's like
Yeah, because we can't. Right.
just go crazy on the greens. But eventually, we up the greens a little and up the Coumadin a little, and eventually we want to get them healthy enough to get off the Coumadin. Now, there's one lady who had like a valve replacement who's going to be stuck on Coumadin forever, but she's balancing it out there, the best she can.
But that is the detail we try to stress, notwithstanding the blood thinner thing, but the diet. People don't know the diet. They, well, are you vegetarian? No, that's not the total answer. No, it's more to it than that. It's the greens, it's the raw foods, it's
Whole
the
food.
juicing, it's all kind of stuff like that. That's what we have, the recipes and the manuals and the DVD. Because, like I said, people come in, well, I'm a vegetarian, I should be. No, it's not.
Yeah, we met one guy, he was eating so much trans fatty acids and junk food, and he was eating no meat, but he literally had caked full of arteries. And now it's reversing, thank God, with the chelation therapy and the change in diet. Nice guy, too. You know what I'm talking about. Yes, ma'am.
About decaf coffee.
You just love, do you love, they said when I went to medical school that I wouldn't get through medical school and residency without coffee. And I did, because I consider it a drug. I took 1 cup of coffee one time and it sped me up and then crashed. I'm like, oh no. But the whole thing with it is that sounds like a bit of a habit to a particular culture to even want. Now, the most I do with coffee, I have to admit, one thing. I love smelling the beans. Oh, it just gives me a natural high. But I don't take it.
Also, it's a great enema for the liver.
Right,
Colorectal.
and we use it for
Best
cancer
way
and stuff like
to
that.
liver out.
Yeah.
We never drink it. We take
Yeah.
the enema with it.
Yeah.
We smell it. Is that what
Yeah, that's right. Now, I mean, there is organic, if you're going to do it, organic decaf is better. Of course, not the chemical decaf if you're going to do it. And, it depends on if you don't do it too much, it probably won't hurt you, but.
substitutions are herb tea,
Right.
ginseng, all kind of things.
Peppermint
Yeah.
tea, hibiscus, red zinger.
Yeah, green tea is supposed to be really good.
And white tea is even better.
Even better.
Yeah, it has more antioxidants. Yeah, white tea from China and red bush tea from South Africa are very high in antioxidants, both of those two. Red bush tea in Southern Africa, yeah, and white tea from China.
So I miss part of the coffee part, but as you're saying, like the regular Folgers or whatever, just stay away from it completely.
Yeah, I mean, to me, what I do when people come into my disease reversal program, I change their whole outlook toward diet. Because, I mean, think of what the typical diet is here in America. It's eggs, sausage, donuts, pastries. I turn, and then coffee with it. And what I do a way of behavior modification that makes you don't even want to do it. You want nothing to do with the whole idea of what people would consider normal food here. Totally flip it.
Yeah.
So how is it bad? What is it? Is it the toxicity?
In what?
As far as the coffee or the caffeine or both?
The caffeine stimulates the cardiovascular system, and it can increase the heart rate, the total peripheral resistance, the blood pressure, and things such as that. Also, it can cause fibrocystic disease of the breasts. It may be linked to breast cancer. It can cause fibroid, uterus, all that sort of
We're
stuff.
talking about the organic kind now, decaf.
Organic decaf is different. Of course, it won't do all that.
I would drink one today.
She's telling me it's okay from the doctor. It's okay.
Well, I'm just asking, so I can give it up.
Is 1 cup a day bad? Is what
For regular coffee?
Yeah.
The question is why you're doing it.
Okay.
If you're doing it on top of a really good diet and just for a taste, but if you're doing it as a drug, you know, to stimulate your, well, no.
She said I drink 1 cup a day with one, and that's it.
Well, it's not caffeinated, so you're not doing it for a drug. But some people use 1 to 3 or more cups just to get by because they're stimulating themselves from a poor diet and poor sleep, and then they wake themselves up with it.
You know, it doesn't add to your nutritional program, period. So eliminate it. That's it. You know, you can take ginseng, you can make smoothies, you can do all kind of things in the morning. The coffee's not one of them.
They say if you got high blood pressure, you shouldn't take ginseng.
That's true. You wouldn't do a lot of ginseng. I meant to say that. Yeah, some people are sensitive to it.
You can do Siberian ginseng.
Right, right. And I haven't seen any studies but that's what the word is. There's all types in a bottle. You can't go by bottle.
Siberian has not got that kick to it. It's more minerals.
Do you recommend that you take fish oil?
You can. Fish oil can lower the blood pressure, omega-3s. Right. What I use, because I'm vegan, I use I'm sorry, hold on. What is it called? It was in my mind. Udos. U-D-O apostrophe S. O apostrophe S. Vegetarian omega-3s. They get it from the seaweed. And that's where the fish get it from. And then it also has some flax, yeah. So that's where I get it. Because some people cannot convert the flaxseed to the DHA, which is the type of omega-3 you want that actually does something.
UDOS?
Yeah, Udos. And you can get it in the refrigerated area in health food stores. Really good. Okay. Hi, I'm Dr. William Rich of the Atlanta Clinic of Preventive Medicine, and today I want to share with you the most powerful healing therapeutic that we offer in our clinic. My friends, today I want to talk to you about chelation therapy. That's right, chelation therapy. Truly a remarkable, life-saving, disease-preventing, and disease reversal technique. That's right, I said chelation therapy can reverse your disease. My friends, a properly administered comprehensive chelation therapy program can be highly instrumental in the following issues. Chelation therapy can cure your high blood pressure. Chelation therapy can cure your high cholesterol and prevent you from getting a heart attack or stroke. Chelation therapy, if you have heart disease, can help you avoid bypass surgery or angioplasty. And if you've had bypass surgery or angioplasty, and angioplasty is when they put a balloon in your artery to expand it, which is a very expensive, dangerous procedure, chelation therapy can help you avoid a repeat bypass surgery or angioplasty. Chelation therapy reverses arteriosclerosis, which is hardening of the arteries. It can improve circulation tremendously because of this, and we'll explain this later. Chelation therapy improves sexual libido significantly and also sexual performance, especially in males. Chelation therapy decreases arthritic symptoms and improves your risk and symptoms associated with diabetes. It can reverse your coronary artery disease and furthermore prevent you from getting cancer. Again, my friends, chelation therapy as part of a comprehensive program is a most powerful healing therapeutic technique to reverse heart and artery disease, where you will no longer need high blood pressure medicine. You will no longer need cholesterol lowering drugs. You will no longer be threatened by heart attacks or stroke. We have many people who have come into our clinic and have benefited this way. You may no longer need bypass surgery or angioplasty of the heart. You can significantly reverse arteriosclerosis and coronary artery disease, while you can greatly improve all illnesses associated with heart and artery diseases or arteriosclerosis, such as arthritis, circulation problems, sexual libido, Alzheimer's and diabetic symptoms, gangrene, and much, much more. We have a client right now in our practice who is getting chelation therapy, and it's actually reversing gangrene of her toe, and she's very happy. She will not have to get surgery in the amputation. Why does chelation therapy do all this? It simply and effectively gets to the root cause of all these heart and artery diseases. That's right, chelation therapy brilliantly works to eliminate and reverse arteriosclerosis or hardening of the arteries. My friends, if we could have a simple magic wand and eliminate all the arteriosclerosis, we would virtually eliminate the cause of heart and artery diseases. And interestingly enough, you would put a lot of doctors, hospitals, and cardiovascular specialists and surgeons, and especially drug companies, out of business. I need to explain to you the key root causes of heart and artery diseases, namely arteriosclerosis or hardening of the arteries. If we look at this diagram, we look at first the cross section of a normal artery. And this is how arteriosclerotic plaque forms in the body. Then the artery opening is narrowed because of deposit of the hardening of the arteries or the plaque. Now at the same time, I want to point out that most of the arteriosclerosis is actually in the walls of the artery. And then the artery can become completely blocked by blood clot, and that's when you can get a stroke or heart attack. So what chelation does is slowly open this area up, and we'll explain that later. Once again, I want to tell you that a well-administered chelation therapy program is unparalleled because it has been emphatically shown to treat arteriosclerosis or hardening of the arteries, which is the single biggest root cause of all heart and artery diseases. You see, chelation therapy is a system-wide treatment that reverses arteriosclerosis in all of your 70 to 100,000 miles of arteries in the entire body. Therefore, chelation therapy goes beyond mere patchwork solutions like expensive and risky bypass surgery and angioplasty. It goes beyond just suppressing symptoms with drugs. I can tell you firsthand, my friends, that chelation therapy really works. But the establishment does not want you to know about this because of the $500 billion industry built around the heart and artery disease management and crisis intervention industry. We have many testimonials, and we have compiled a book, a small booklet of chelation testimonials. I want to go over some of those favorite testimonials with you. One testimonial I'll share with you is Sherman Miller's story. He's a 74-year-old man who came to me several years ago after having 3 arterial bypass surgeries with no relief whatsoever. And he was getting 7 medications, came to us in a wheelchair, getting pain several times a day, and no help in sight. What happened? We put him on our comprehensive chelation therapy program, and he's written a wonderful testimonial stating, I quote, "I feel these treatments have added more years to my life. I can now walk, bicycle, garden, and practice yoga. This man's life has been totally changed around with chelation therapy. He's off of all 7 of his medications." Another patient of mine, Art Miller, he wrote a note, or his wife did, from despair to happiness. And she states that her husband had pain in his chest, couldn't walk any distance at all, and took a catheterization from the cardiologist showing blockage. And the cardiologist said there was nothing that could be done, only medications. He was scared to drive, even move. And that's 7 years after bypass surgery. Then he heard about chelation and came to our clinic. We covered in our lifestyle counseling, food, exercise, and everything else that's needed to build on a comprehensive chelation program. And it states here, after few treatments, Art started driving, walking, doing anything he wants to do without pain. It has turned our life around. Every phase of our life is wonderful, and I expect Art to live a happy, normal life from here on. Another very important testimonials from Bud Moore, and this was written in 1997, and he states in November of '94 he spent 5 nights in a hospital because of chest pain due to heart disease, and studies showed, in other words, the angiogram showed a 99 and a 70% arterial blockages. Angioplasty was performed. That's where they put the balloon into the artery, opening it up, but the relief only lasted 1 week. He then began chelation therapy with us. I even helped him rent an oxygen tank to use at home to treat the pain that he would get. He could only walk a short distance without pain. After 4 months on chelation, he no longer needed the oxygen and he was walking a half a mile per day. A great accomplishment. Well, now let me tell you, he's walking 2 and 3 and more miles per day, walking up hills, and we also were able to wean him off of 4 medications that he was on. I can tell you about my mother. My mother moved here from Pittsburgh to Atlanta and was on 5 medications, and her cholesterol was 220. We put her on our comprehensive chelation therapy program, and her cholesterol dropped to 170. She's off of all 5 of her medications, and her blood pressure is normal. I can tell you from firsthand experience and volumes of research that chelation therapy reduces arteriosclerotic plaque 30%, and it only takes a 15% increase in the interior diameter of the artery. In other words, if we look at the diagram again, if we just get rid of 15% of this plaque, it improves the blood's flow 30%. That means small reductions in arteriosclerotic plaque can result in tremendous increases in blood flow. From many studies, chelation therapy has been shown to be at least 85% or more effective in improving problems associated with heart and artery diseases. Chelation therapy is safer than taking aspirin and has little or no side effects. What exactly is chelation therapy? It is an IV treatment that it introduces a synthetic amino acid into the bloodstream called EDTA, and that's ethylene diamine tetracetic acid. It removes toxic heavy metals such as lead, cadmium, arsenic, and aluminum from the body. Chelation therapy also helps prevent and reverse arteriosclerosis. It lowers calcified deposits in the arteries and the joints, thereby helping arthritis as well as hardening of the arteries. Chelation therapy lowers the LDL or bad cholesterol. Chelation therapy actually improves your kidney function, improves your circulation, improves your immune system, and greatly reduces risk of cancer. It also reduces diabetic symptoms. In closing, we invite you to experience our comprehensive chelation therapy program. This program will include IV chelation therapy with EDTA, healthy dietary training, healthy lifestyle training, nutritional and herbal supplements guidance, exercise training, stress management training, and also sound medical management that A, safely weans you off of those medications, B, keeps you out of the hospital, and C, keeps you alive and out of the funeral home and cemetery. So, my friends, if you are interested in curing your high blood pressure, if you're interested in curing your high cholesterol, if you're interested in preventing that heart attack or stroke, or avoiding bypass surgery or angioplasty, and if you've had one, if you want to avoid repeating those invasive medical procedures, if you want to reverse your hardening of the arteries or arteriosclerosis, improve your circulation tremendously, help and improve your sexual function and libido, and help reverse your symptoms of arthritis, diabetes, and even reverse your coronary artery disease, and get serious about solving the root cause of your heart and artery disease, and follow my loving and humble advice by signing up today for our comprehensive chelation therapy program. The benefits: it may save your life. It will extend your life. It will greatly increase the quality of your life. You are quite worth the investment. Again, if you want to take control of your health and reverse the root cause of heart and artery diseases today, our comprehensive chelation therapy program is the answer that you've been searching for. Thank you, and may God bless you and yours on your health quest. And we're here to serve you. This is Dr. William Richardson. We've done a lot of research and have a lot of experience in administering a comprehensive chelation therapy program. Some of our sources of research include the book 40 or Something Forever, Bypassing Bypass Surgery by Dr. Cranton, Reversing Heart Disease by Dr. Dean Ornish, Reversing Heart Disease by Dr. Julian Whitaker, Heart Disease Alternative Medicine Guide to it, and the McDougall Program for a Healthy Heart. We've culminated this knowledge in our manual for reversing heart and artery disease. Our manual, Heart and Artery and Disease Reversal, is accompanied by the video, You Can Reverse Heart and Artery Disease Now. We've compiled a list also of chelation testimonials, which are available at the clinic for your perusal and your study, as well as inspiration. We also have a handbook for the patient called EDTIV Chelation Patient Handbook, complete with the testimonials, the what, how, and why, costs and prep, my credentials, applications and benefits and case studies, clinical studies and informative articles on the subject of chelation therapy. Again, I want to thank you for listening and invite you to join me in your comprehensive program for chelation therapy. I want to now invite you to listen to our fantastic video chelation therapy testimonials.
My name is Sherman F. Miller. I'm a patient of Dr. Richardson. I'm taking chelation therapy because I found after having open heart surgery for 3 times with no success that actually I was headed for the 4th. And the background of this is I had been to the point that I couldn't even walk up a flight of stairs after my last open heart surgery. I was at the point that I had to be put in a wheelchair and rolled around because I know that at that time I was unable to do anything. I couldn't go upstairs, I couldn't come downstairs. I was completely helpless. And I was told by a friend of Dr. Richardson I should see him about chelation therapy. Since taking chelation therapy, I can give you some points that actually, knowing that it'll help me. I've been able in the last year to do anything, more things than I was able to do before I started taking it. I'm at the point now I find that I'm at the age of a person who would do 45 or 50 years old. I'm able to walk 2 to 3 miles at a time. I'm able to ride a bicycle 2 and 3 miles. At one time, since taking chelation, I was able to walk from 25 Peachtree all the way back to the center of Atlanta, wow, which was quite a big walk.
How old are you now?
Now I'm 71. I'll be 72 this coming next week, to put it. So actually, now I'm find that I was able this year to cut the lawn. I was able to mow. I was able to take my tiller and till up a half of a yard. I was able to till up the total front yard and half of my backyard, which is a little over a good acre. Now I'm able to do anything I would want to do anytime I would want, and I have no heart problem, no pains. Recently I took a beginning of an exercise, being able to do 300 and 400 repetitions per hour and a half. So chelation has been a lifesaver to me. I've talked to several people about it. I've introduced people to chelation therapy and tell them the benefits of chelation compared to bypass surgery. I know now that chelation works. Most people ask you, how do you know it works? Well, look at me, for I'm able to do anything as a man who is 50 years old or younger. I'm able to go, I'm able to come, I'm able to drive, I'm able to, well, just say anything necessary.
That's great. Now, just recently, you were taking off all your medications? What's up with that?
As of last month, as of the last of November, I was taking off all medication. I take no medication whatsoever for my heart problem. The only thing I take now is chelation. I come and take that. I'm at the point I'll take this periodically to keep the arteries open, but other than that, my Dr. Richardson took me off of all medication.
What medications were you on?
I was on Zocor, I was on Metoprolol, I was on Prenavil, I was on aspirins, and quite a few nitro, and actually I've been taken off of all of that. I started off with a 0.6 nitro, and when he took me off, I was on a 0.1.